Hi, my name is Joshua Brown from the interview training company howtobecome.com, and in this presentation I will teach you how to pass your registered nurse interview. So if you have an RN interview coming up and you need to prepare for both the most common and tough competency interview questions for a registered nurse role, then please make sure you watch this video from start to finish, because I'm going to help you to stand out and succeed. To achieve that goal, this is what I'll cover. I'll start off by giving you a list of registered nurse interview questions that I strongly recommend you prepare for. I'll also provide you with example high scoring answers to those questions to help you to succeed. I'll also make sure to give you some essential tips for passing your registered nurse interview before finally telling you how you can download further resources including all of the answers to help you to prepare. And just very quickly, please don't forget to subscribe to my channel, because I want to help you to pass your registered nurse interview, and I can only do that if you are subscribed. And please don't forget to hit that like button, because this tells me you find these tutorials useful. Okay, let's take a look at that first nursing interview question that I recommend you prepare for, which is, tell me about a time when you had to work with a rude physician or supervisor. Now, it is vital that you can handle conflict and disagreement when at work. There will be times when you disagree with your supervisor, but it is vital that you put the needs and safety of the patient first at all times. It's also vital that you work as part of a team. There's no place for people who do not collaborate in healthcare. And finally, you must make sure you remain calm and professional at all times, and you can put your unbiased views across with a level head. So it's really important you get those 3 points across in your answer to this tough interview question, and it is a really tough one. And before I give you a brilliant example answer to this tough interview question, my advice is to structure your answer using the STAR method, and you should do this when answering any tough behavioural interview question just like this one. So the STAR method, or the STAR technique, stands for S for situation. What was the situation you found yourself in? T is for task. You need to describe what was the task that needed to be carried out. A is for action. What action did you take to achieve the task? And finally, R is for result. What was the end result following your actions? So make sure you use the STAR technique or the STAR method when answering tough nursing behavioural interview questions just like this one. So let's take a look at a brilliant example answer to help you. Tell me about a time when you had to work with a rude physician or supervisor. Due to staffing shortages, I was assigned to work on a different ward than usual during my previous employment at a major hospital. On my first shift on the ward, whilst caring for a patient, the on-call consultant arrived to evaluate the patient's injuries. I observed that the doctor had not disinfected his wounds before going to examine the patient's open wound, in violation of hospital protocol. I was not willing to compromise the safety of the patient and quickly made the decision to request a private conversation with the doctor outside the room. I did this to uphold the integrity of the doctor in front of the patient, whilst also ensuring the safety of the patient, therefore making sure our duty of care was upheld. I respectfully informed the doctor of his mistake, yet he was visibly angered by my actions. He raised his voice and maintained that I should have waited until after his assessment of the patient to have the discussion, and that it was not my responsibility to challenge him. I stood my position in a professional manner and calmly emphasised that, in accordance with hospital policy, the patient's care and safety must always be our primary concern, and that I was acting in the patient's best interest. At the end of our shift, he approached me and apologised for his behaviour. He explained that he had been rushed off his feet largely due to personnel shortages, and that he was genuinely mortified to have made such a potentially serious mistake. He continued by explaining his behaviour was unacceptable and that I had acted in an exemplary and professional manner. I accepted the doctor's apology, and we worked together productively and harmoniously for the rest of my duration on the ward. Now that's a really good answer to that interview question. Tell me about a time you had to work with a rude physician or supervisor. We will look at more behavioural nurse interview questions later, but the next question I want you to prepare for is, why do you want to work for our healthcare organisation as a nurse? Now this interview question again is a really tough one. You need to make sure your answer focuses on how you admire how their healthcare organisation is run and the values they stand for. You must demonstrate your passion for their healthcare organisation, show you understand their reputation for delivering first-rate care, and your commitment for wanting to work for them long term. So here is a great example answer to help you. Why do you want to work for our healthcare organisation as a nurse? I want to work as a registered nurse for your healthcare organisation because I want to be part of a service that provides the greatest level of care and attention to its patients. I'm aware of the values by which your healthcare centres operate and believe strongly that they align with my own personal beliefs, which inspired me to pursue my career. I believe that I will be respected in my role as a nurse at your healthcare organisation, and I'll be provided with the resources to do my job properly as part of a wider healthcare team that truly cares for many years ahead in my career. I particularly admire your dedication to the preservation of privacy, dignity, and the utmost respect for all patients during their duration of their treatment. Upon thoroughly researching your organisation's mission and beliefs, I am aware of how seriously you take this commitment, ensuring that every patient is assigned a private room with ensuite amenities. Inducing calm and confidence in a patient can make for a far more pleasant medical experience. I also want to work for your healthcare organisation as a nurse because I am aware of the high standards to which you uphold your medical personnel, and not only do I believe I would be able to meet them, but I would also be excited to work with a team of like-minded professionals committed to providing the highest level of treatment and care possible to our patients. Now don't go anywhere, as I still have more interview questions and answers to give you, but when you're ready, click that link in the top right hand corner. It'll take you through to my website, howtobecome.com, where you can download my 30 registered nurse interview questions and answers for all healthcare organisations, and it's going to give you the edge in your interview. And it also includes the questions we're covering right now. Okay, here's the next registered nurse interview question for you to prepare for, and that is, what are the most important qualities a registered nurse must demonstrate in his or her job? Now, wanting to help people, have competent skills, be a great collaborator are all great qualities to mention. But as well as mentioning those, you need to also make sure you demonstrate why these skills are so important. This is how you score top marks for this interview question. So here's a great example answer to help you. What are the most important qualities a registered nurse must demonstrate in his or her job? A successful registered nurse must, in addition to being skilled within their medical profession, be compassionate, exhibit good collaboration qualities, and ultimately have a strong drive to provide the best degree of care and treatment to every patient who is under their care. It is essential to have a compassionate approach toward patient care, since for many people, hospital treatment may be very traumatic, and simply seeing a friendly face can make all the difference in the world to a patient's experience. Working effectively and harmoniously with various health professionals means that the patient can receive the best care possible, and each and every staff member should be united in this common goal. Ultimately, I believe that the unwavering dedication to placing the needs of their patients ahead of all other concerns at all times is the most important trait that a registered nurse can exhibit. The next registered nurse interview question that I recommend you prepare for is, what does compassionate care mean, and how would you deliver it as a nurse? Now, to be an excellent nurse or healthcare professional, compassion is vital. Compassion in nursing is essential for not only reassuring and comforting the patient, but it's needed so you can obtain the right information to assess a patient's condition and to create a suitable treatment plan that is appropriate and effective. That is really important to remember. And don't forget to also tell the hiring manager how you will demonstrate compassion in the role. So here's a great example answer to help you. What does compassionate care mean, and how would you deliver it as a nurse? A registered nurse's compassion is crucial not only for the patient's emotional well-being, but also for the accurate assessment of the patient's condition and the development of a successful treatment plan. Encouraging gestures, demonstrating to the patient that you understand what they're going through, ensuring them that they're getting the best quality treatment available, and patiently addressing any concerns they may have are all ways in which nursing professionals may show compassion. A patient's therapy and rehabilitation can be enhanced by the presence of a supportive individual who is willing to listen to their concerns and experiences. As a registered nurse, I would express compassion by maintaining a pleasant demeanour at all times, actively listening to the patient whenever they spoke, and offering comfort in moments of crisis. Furthermore, I would also make a significant effort to treat patients with dignity and respect by following common courtesies like knocking before entering a patient's room and respecting their privacy whenever possible. It's always been my aim when becoming a registered nurse to help rehabilitate people and make people's lives better, and that is driven by the compassion I have to help others. Wow, that's a brilliant answer to that question. What does compassionate care mean and how would you deliver it as a nurse? Let's take a look at the next one. Tell me about a time when you dealt with an upset or angry patient. What did they say or do and how did you react? Again, this is a really tough behavioural nursing interview question. And it's important to remember here that dealing with difficult patients is a reality many medical staff face. The hiring manager at the healthcare organisation will want to know that you will remain calm and professional and represent their organisation in a positive light at all times. It is therefore essential to demonstrate that you will not be reactive or respond negatively ever. Instead, again, make sure you demonstrate compassion, calmness and professionalism. Show that you have good communication skills and that you are aware you are representing the organisation and you can follow its policies. So here is a great example answer to help you. Tell me about a time when you dealt with an upset or angry patient. What did they say or do and how did you react? Whilst working in my previous position, I encountered an elderly lady who was visibly distressed and upset by her care being discharged from my colleague due to their shift coming to an end. I made it my task to reassure my patient felt calm and confident in my care. I made her a cup of tea and took the time to sit by her bedside to discuss any concerns she might have, whilst reassuring her of my capabilities in a calm and empathetic manner. I learned that she was particularly concerned about her dignity being preserved during her stay in hospital. I promised her that I would take personal responsibility to ensure that she would be treated with the utmost care and respect for the entire duration of her stay in hospital. She thanked me profusely for taking the time to address her worries in a respectful and kind manner following our talk, and I could see that she felt much more at peace. For the duration of my shift, I paid close attention to her, ensuring her comfort and contentment. I am the type of person who remains calm under pressure and will always take responsibility of challenging situations when they arise. I believe in doing so in this instance, and by showing empathy and compassion, I was able to provide a positive outcome for the patient. Now, in preparation for your registered nurse interview, I also recommend you prepare answers to the following questions. How would you handle the stress of being a nurse and all that comes with the job? Tell me about yourself. Where do you see yourself in 5 years' time? What's your biggest weakness? What are your main strengths that will help you to be a competent nurse? Do you prefer working as part of a team or are you better working alone? What parts of the nursing position will you find the most enjoyable and which parts will be the most challenging? How do you deal with conflict with a co-worker? As you are aware, the role of a nurse is extremely demanding and challenging. Tell me about a situation when you worked hard to achieve a difficult task whilst working under pressure. Describe a time when you managed multiple tasks all at once. What are the values of this organisation and how do you ensure you implemented them in your daily work as a nurse? Can you give an example of when you demonstrated a commitment to the quality of care? Describe a time when you've shown flexibility. What would you do if you witnessed a patient being treated poorly by another member of the nursing staff? So the next thing to do, if you would like to download example answers to these and all of the toughest registered nurse interview questions, is to please make sure you click that button in the top right hand corner of this video right now. Head through to my website, howtobecome.com, where you can download these slides and get access to 30 registered nurse interview questions and high scoring answers to each question in a PDF guide. You can literally have access to these and the slide within your inbox within 2 minutes from now, and it's guaranteed to help you prepare effectively for your registered nurse interview and also, more importantly, put you ahead of the competition. I hope you've enjoyed this tutorial. Please don't forget to subscribe, as I'm on a mission to help as many people as possible pass their interviews, and I can only do that if you are subscribed. Please also hit that like button, as that encourages me to make more videos just like this, and if you have any questions regarding any job interview, please feel free to put these in the comments section below where I will get back to you. And finally, if you'd like to connect with me on LinkedIn, I've put my LinkedIn link in the description below. It's always great to connect with like-minded professionals such as yourself. Thank you so much for watching, and I wish you all the best with your nursing interview. Have a brilliant day.